For all of you who don't know me, I'm Ale. Yeah, welcome to my channel. Today's topic, it's going to be a little bit more hard to talk about, kind of, I guess. I don't know. I'm not really sure where it's going to take us, really, because it's slightly more touchy or just hard to explain or put into words. I was born with a condition. I'm not really sure how to pronounce it. It's called Artrogriposis, and it's basically a condition that affects your joints. You know what? I'm just gonna Google it. Okay, so Artrogriposis. Oh, it has a picture. I'm gonna show it to you. Picture of a baby that looks nothing like me when I was a baby. It's not focused. Artrogriposis describes congenital joint contractures in two or more areas of the body. You know what? This is the first time I've ever Googled this. This is going to sound terrible, but I've never been really interested in this subject. Like, I live with it and I talk about it with my doctors, of course, all the time, but I don't know, I've never really looked deep into it. I guess it kind of gets me a little bit depressed sometimes, even as a child, to read some of the words, like medical terms like malformation and stuff like that. It used to affect me a lot, so I used to avoid reading about this. But yeah, okay, I'm going to just keep going. Children born with one or more joint contractures have abnormal fibrosis of the muscle tissue, causing muscle shortening, and therefore are unable to do passive extension and flexion in the affected joint or joints. I'm not unable to do passive extension and flexion. I am. Okay, yeah, that's what I can. Yeah, I can. So basically, there are three types of arthrogryposis. The first one, it's called amyoplasia, and it is characterized by severe joint contractures and muscle weakness. I don't think that's the one that I have. Distal arthrogryposis mainly involves hands and feet. Yeah, this is the one. This is the motherfucking one. Okay, so enough with Wikipedia. This condition, basically, it's more severe for some people. I know some people who have it. They are never able to walk. So I guess I'm pretty lucky in that aspect, if you may. To me, it's really visible in my hands and my feet. That is why you don't get to see much of my hands. Of course, in everyday situations, yes, people see my hands all the time. But on the internet, I feel, I don't know, I'm not quite there yet. That's also why, even when I move my hair, when I'm editing the video, I cut those parts. Like now, or now, or now. Now I'm just making myself editing a lot, so I'll stop now, but you get the point. Also, because I've never read this before, if it says something like people who suffer from this condition are going to die at age 30, this is gonna be much more sadder and depressing video than I thought it would be, so sorry. Almost every joint in a patient with Can we just call it something easier? Like, I'm just gonna call it Rexona from now on, okay? It is much easier for me. Almost every joint in a patient with Rexona is affected because in 84% all limbs are involved. So, okay, enough with the terminology and shit. I'm just gonna talk about my experience as a disabled person. I don't usually use the word disabled. I don't know, it's kind of like the word for me. Well, there are two words with the that I'm not interested in. but I'm not usually use the word disabled because I don't know. I don't know. I do fit in the category of disabled. When you are born with a condition, you just know what it is to have it. Like, I don't know what it is to have a normal body type. I don't know what it is to have normal functioning hands and feet and nice moving arms or legs. So it's not like I can't say, because I've lived with this through my whole life, right? I'm just gonna talk to you about my experience a little bit of having this condition. I can't really put my finger on what the differences or the struggles of my everyday or when I was a child or anything, because I've had more surgeries that I can remember. I think the first one was the day I was born. I'm not really sure because I don't remember, but yeah, I've had quite a lot of surgeries and I can't decide if I want to keep having them, but the recovery is always so traumatical and the results after the surgeries are not always as good as one expected them to be. So it doesn't feel like it's really worth it every single time. As a child, it was difficult in a sense because children are much more sincere and honest and straightforward, obviously. But in a way it was easier because when I met a kid, like the first thing they will ask me it was what happened to you? So I will just have to say like, oh, I was born like this, and then they will just leave it or ask me one or two more questions and that was it. But then as you grow older, people are filled with taboos and they get really awkward about it, even if they are not the ones with the condition. So yeah, my childhood wasn't as difficult as it could be. To me, the hardest parts were the surgeries and having to spend a lot of time in bed, and like every time you get, for example, a foot surgery, you have to, I think it applies for everybody, but you have to learn how to walk again. It is really painful. To me, the hardest ages were around 13, 14, 15 for sure, because teenagers are really critical. So when you have like a physical disability, it's much more easier to discriminated by it or insulted by it, of course. I also developed a lot of depression and anxiety in my teen years. So they used to invite me to parties a lot, and I got super nervous because parties, obviously the main focus, it's like in meeting new people. And when you have a physical, visual disability, that's like your worst nightmare, at least for me. So, for example, like greetings are the thing I hated and I still do the most, because in Spanish culture, when you meet someone, you give them your hand and you shake the other person's hand, and I've always hated that so much, because it's like straight away, you can't hide it, you give them your hand and they will look down and it's like, oh, that's a weird looking hand. So my battery died. I'm just gonna mention a few things of a very long list of things that I can't do. Having Rexona means that my movements are very limited. So of course I can't do like gymnastics, or I've had people telling me I walk funny, and I'm also like slower than many of my friends. I have very low resistance. Of course that will improve if I lost weight, which has nothing to do with my condition. It's just that I really like sweets. But I'm getting out of topic here. Okay, I can't do ponytails. So usually when I'm gonna do some exercise, I just keep my hair down or have a friend doing it for me. I can't really open my mouth that much. I'm not showing that to you. I can't really lift my arms that much. Like, I think this is as much as I can lift them. I get super uncomfortable when I have to sit on the floor. Like, you know, when you're a child, there are so many games and activities that have to do with you being sitting on the floor. That for me was like hell, because it's really painful, but I also didn't want to get like special attention and have a teacher bringing a chair for me, so I would used to pretend it was fine, but then I would just help hold my weight with my hands, and my hands will get numbed and my limbs, my legs will get numbed, so I hate it. What else? Basically I just get tired very easily. I have pain in general on a daily basis, like just walking. I'm just so used to it that only if it's really extreme I stop doing my general activities. But let's say if I go out to a nightclub or something, the next day, to me walking it's like almost impossible. Like, I have to take so many medicines. And what else? I don't know. As I said, it's really hard to think of, because I just live like this, right? I live on my own, so I guess it's not as bad because I get to do everything on my own, and if I can't do something I just manage. Well, also I've never met anyone with this condition before, so if you're watching this and you have this, feel free to send me a message, because I would love to meet people or hear from people who lives under the same circumstances that I do. But if you suffer from any disability and you're having a hard time, especially if you're a teenager, I just trust me on this one, it gets so much better when you grow older. Now I'm 20 and I don't know, of course I have good days and bad days, and as I said, I have struggled, and I do struggle with depression a lot and anxiety, but since I grow older it's been so much easier, because you stop remembering you are different. So yeah, it does get better. You will face really bad situations, and you know what, it is not fair. It is not fair that you have to go through this, but life is not fair, and I assure you there are gonna be great moments that are going to make all the struggle worth it. And I myself, I have to remember that and think about it, because I don't do as often as I should, and I complain a lot, not with people but with myself. And you can't feel sorry for yourself, because then you lose. At the moment when you start crying for yourself and hating life because things are just not fair, you lose. You can't feel sorry for yourself. And yeah, that's pretty much it. I don't know if anyone's gonna watch this at all. I don't know if this is going to help anyone at all. I think like it helps me to talk about it, so maybe it helps you. And yeah, let's see. Okay guys, thank you for watching. Artrogriposis. Do you hear that ticking sound? It ages To me, the hardest ages